donkeys, but we do know that they are a very high-risk form, which is hyperlipaemia. And then, just at the end, we've obviously spoken a little bit about weight management and obesity already. We'll just link that into laminitis, and just in a few slides at the end, we're going to just really kind of drive home the don't feed your donkey starch and sugars messages that I've been banging on about all morning now. So, we've hopefully learned a little bit already, but that was unexpected. What we're hopefully going to learn in the next bit is, from the point of view of hyperlipemia, why prevention is most definitely better than cure. What do we know about the risk factors for developing hyperlipemia? A little bit about how we diagnose it, a little bit about how we treat it, and then say a little bit at the end about metabolic syndrome and obesity and the risks of laminitis. So when I was sort of thinking about putting this talk together, the first thing I sort of thought about was, what are we doing from the point of view of our population? And I went back to our records. Ideally, I wanted to try and get 2013, but for some reason the computer said no. So what I've got is our 2006 data and our 2011 data. There's not a huge amount of science behind this. This hasn't been analysed at all, which is kind of raw data. What I was just interested in, because anecdotally we thought we were dealing with less cases. Just to put it in perspective, we've got about 2,500 donkeys. So it's obviously not a large number proportionally in any case. But in 2006, we dealt with 107 cases of hyperlipemia. Unfortunately, there were 37% mortality, but that's not outside the realms of standard kind of expectation for this condition. And I split that up into how many we had in our new arrivals, and that will hopefully become apparent later on why I was interested in that. And certainly in 2011, again, we say there's not a huge amount of science behind this, it's just 2 years, 2 bits of data, but it was quite pleasing to see that we actually, in 2011, only treated 64 cases. Disappointingly, our mortality rate was higher, but the mortality rate is very variable based on how severe the hyperlipemia is in any case. And we still had quite a large number in our new arrivals. But again, the only bit of data I could get for 2013 was on new arrivals, and that was pleasing from my point of view, because we had the perception that we were reducing the number that we were getting in our new arrivals. But I think the figures to back that up, we certainly only had 4 cases in the whole year, and bearing in mind we bring in about 300 donkeys a year probably. So that sort of made me think, well, okay, I'm quite happy about that, but what might we have been doing? We have been doing quite a bit in the last few years. What might we have been doing that actually had an impact on our numbers of cases of hyperlipemia? And the first thing, I sort of talked about this already when we were talking about various things to do with nutritional problems and the type of donkey we might be needing to feed. We have got a lot better at assessing our donkey's quality of life. To the extent that we've got it sort of a bit more formalised now, and I think it's important to do that because often we're talking about donkeys with a lot of different chronic conditions that are deteriorating slowly. And unless you keep a monitor on these things can get out of hand quite quickly and you don't necessarily notice it. And the other important thing about this is that when you're talking about assessing an animal's quality of life, everybody involved with that animal has an input to that. It's not just the vet that comes in and says, okay, it's got this wrong with it, this is the problem, I'm worried about it, etc. The people caring for those animals have a massive input into assessing those animals on a daily basis. And they are incredibly valuable in monitoring over time what might be happening. So we sort of developed these sheets that we can use for animals that are of concern to us, and we can look at the types of conditions that we're worried about, and these would be a fairly standard types of conditions that we're worried about in our elderly donkey population. So things like arthritis, probably linked to why we've got hind limb stiffness, and poor teeth. And then again, just to give people an idea of what we can and can't achieve, we can look at the sort of endpoints that we might be concerned about. And these, you can have any endpoints you want on there. These are just some that we tend to use quite commonly. And it's looking at when we're not actually managing to give this donkey a good life anymore. And we've got to bear that in mind. And we all have a finite lifespan, and things deteriorate. And one of the things, obviously, from the point of view of our ability with animals, is that if we see that an animal is not coping, and potentially has poor welfare and is beginning to suffer, and we can make a decision for them. It's obviously a very, that's quite a responsibility, and we need to make that decision well. But if we can start to qualify and quantify why we're making that decision, and get everybody on board to the fact that we've done everything we can, we knew that if we got to this stage that we wouldn't be able to do anything more, then I think it can be very valuable to getting everybody to understand why we're doing something, and also from that animal's point of view, do the right thing by that animal at the right time. So we can look at what we're doing, what medication the animal's on, how things are working. We're lucky we can weigh our animals, so we can get our monthly weights down there. As you can see with this donkey, it's started to lose condition, not eating so well, the demeanour deteriorating, becoming a less alert donkey, lying down a lot. Now this is something that as donkeys and horses get older, they're not like people. They don't want to rest more, they don't want to lie down more. That's not a normal behaviour for a herbivore. It's highly dangerous to do that if you're a herbivore. You get killed. So it's not a normal behaviour. People think, oh yeah, my donkey's getting a bit older. Okay, so now it's lying down more. That's a reasonable thing. It's not. It is not normal behaviour. So that's one of the important things that we do look at. And things like, and then whether they're struggling to get up. So if we're starting to see pressure sores, either because we know therefore they've been laying down for too long, or they're traumatising themselves when they're getting up. If that's not normal for a donkey to have to cope with that. And if we're trying to manage that, and we know we're doing everything we can from the point of view of pain management and whatever else, and this animal's still struggling, then that suggests to us that we're not an animal that's having a good quality of life. So I think that's one of the important things that we've done in the last few years that maybe has helped reduce our incidence of hyperlipaemia. Another one we just talked about that is appropriate feeding, and this is quite a useful slide. I guess the point we just want to talk about different types of digestible energy content in the feeds that we've got available, at least in the UK. You can see there's a wide range there, but what we're doing there is the types of feed we've got on there are all feeds that are the right types of feeds to be providing to donkeys depending on what condition they've got. So they're all high fibre, and there'll be low starch and sugars. So if they have got a higher energy content, like for example the epidural down there, that's an oil-based higher energy content. And things like the donkey diet, again, that's not being, the energy increase in there is not starch and sugar related. So you can see if we look at the way we feed our donkeys, I think that in itself is another good way that we've managed to reduce our incidence of hyperlipemia by, again, this kind of triple feeding, and if we're supplementing that triple feeding, we're supplementing it with high fibre products and not starches and cereal-based products. And then the other thing, we're very lucky we can weigh our donkeys monthly, but we take a lot of interest in our monthly weighings. It's not just an exercise. We look at the monthly weights, we're looking at, say, trying to keep them in this 2.5 to 3.5 body condition score. But if they drop weight or they gain weight, so particularly if they lose more than 5% of their body weight in a month, they'll have an exam, and that will include a blood sample, just so that we are keeping on top of impending conditions that might be starting to cause us problems. And I think that means that we are alerting ourselves earlier in the process to problems, and hopefully either addressing them or making decisions based on what we find. And our sort of routine management is over and above the weight management is there. So they have regular dental checks, minimum of once a year, and obviously if there's any problems found, that might then be tailored to more frequent dental checks, but they certainly get a yearly check. I think that's really important. Just because these animals don't have bits in their mouth, they're not being worked, they do get dental disease, and it can be a massive problem for various conditions. I spoke before about the fact that it can cause impaction colics, and you'll see in a moment that it is actually a risk factor for hyperlipemia as well. So do get your donkey's teeth checked regularly and effectively. The only way it can be done effectively is if you've got somebody that's ability to open that mouth, so you need some sort of spectacular gag that can then mean that the person examining that mouth can look right to the back of it and see what's going on. And ideally you also want a good light source as well, so that again you can see what's going on in there. And then it sort of talks about the new arrivals. we're a lot more careful about what we take in, and assessing, again, quality of life before the animal arrives, with us prognosis from the point of view of travelling, and what conditions that animal has that may not be treatable. So this donkey, as you can see just from the outside, you'd have concerns about what's going on with those feet. Obviously they're very misshapen and overly long, but there's quite obvious analytic rings there as well. And when we radiograph that foot, as you can see, this animal has unfortunately had a series of laminitic episodes that meant that we actually got no penile bone left. In an ideal world, the penile bone should be sort of that shape. We might see one another really well later, but that's basically just gradually deteriorating. This animal would not cope with travel. This animal is probably in, at the very least, discomfort and possibly pain. So we will make decisions based on what we find before animals come in to ensure that we don't adversely affect the welfare of any of the animals that we're caring for. So that's my opinion on some of the things that we're doing that maybe have started to help reduce our numbers from the point of view of hyperlipemia. And hopefully when we now look at some of the risk factors in a minute, we'll see why some of these things are hopefully helping. Before we do that, we've got a bit of scary slide here, but we do need to kind of work out a little bit what we mean when we talk about hyperlipemia. So this is what the condition we're talking about. We start at the top here. Something stresses this animal. We'll talk about what we mean by that in a minute. And when this animal gets stressed, it loses its appetite. It goes into what we call a negative energy balance. At the same time, it releases hormones, it releases stress hormones like cortisol. What that does is it stimulates a particular enzyme that breaks down fat. So in essence, we've got a stressed animal in a negative energy balance. The body says, I need some energy, so it breaks down fat. So we get this release of free fatty acids. Normally, we've got a liver that kind of processes that, and various things would happen. But unfortunately, if this process is becoming out of control, the amount of fat that gets released exceeds the ability of the donkey's body to convert that. What should be happening in a normal situation is that this massive amount of fat release triggers another hormone system, insulin, to have this negative feedback effect to try and stop it. The problem we've got is that this again is sort of out of control, but also, and again we'll see this a bit later when we talk about some other problems, metabolic problems donkeys have, is donkeys are inherently quite insulin resistant. If they're also overweight, that in itself can increase insulin resistance. So this feedback mechanism, unfortunately, is not strong enough to counteract this massive amount of fat that's being released. Fat goes out, it gets converted into triglycerides, packaged with proteins, and gets released basically into the circulation. Again, we've got another feedback mechanism here, which is that we've got another enzyme which is frantically trying to break these back down again, but unfortunately this process just becomes out of control, and this system is kind of swamped from the point of view of stopping this release of fats into the circulation. Hyperlipemia just basically means excessive fat in the circulation. So that's what you've got to hold in your head as to what's happening during this process. Oh, sorry.
Could you repeat the word about the donkeys being insulin resistant?
Right. So donkeys inherently are insulin resistant. So in essence, that means that they don't respond well to insulin from the point of view of taking up things like glucose into cells. Yeah. So that's a problem in itself. But then superimposed on that, being overweight again increases your insulin resistance. So it just basically means you can release as much amount of insulin as you want, but its effect is basically damped right down so that it's not doing what you want it to do. In this case, what it's not doing is inhibiting this process of fat breakdown. Okay. So we've also done another study looking at the risk factors for hyperlipemia. It was a 4-year study. At this time, our cut-off values, now we can say, I hope we converted it correctly for this audience, our cut-off values, we work with millimoles per litre, so our cut-off is 4.4, which equates to a kind of conversion factor of about 89, so it converts to 392 milligrams per decilitre. since this study we did this study, we've actually tightened up on our levels. We're now looking at levels of 2.7 millimoles, which I think converts to about 240 milligrams per deciliter in your units. So we tightened it up from the point of view of our normal healthy animals. We're hoping they have a triglyceride level lower than that. So but for this study, it was categorised as anything higher than 4.4. So we found about a prevalence of about 11% of the population over this time frame had suffered from hyperlipemia, and the mortality was about 49%, which is fairly comparable to most studies looking at hyperlipemia. The mortality goes up significantly depending on the severity, as Thomas mentioned earlier. So if you go over 15 millimoles per litre, which is I think somewhere in the 1,300 milligrams per deciliter point of view, then you get up to about 70% mortality. So it is a life-threatening condition, which is why we certainly want to go with prevention better than cure. So if we can work out what the risk factors are and then try and control as many of those as we can, then hopefully we are improving the situation for our donkeys. It's probably not that surprising that younger donkeys are more likely to recover as well, but we'll see why that's the case as we go through the various risk factors. So the main risk factor that we came up with was actually concurrent disease. So anything that a donkey is already suffering from puts it at risk of also suffering from hyperlipemia. We've already talked about dental disease, but say it can be any body system. Classically, it's always been linked to colic, and the studies showing that if a donkey's colicking, then they are at a higher risk of hyperlipemia. But we see it in any conditions, whether it's got laminitis, whether it's got liver disease, so that's sort of an end-stage liver up here. This is something we see quite commonly as well, which is pulmonary fibrosis. That's supposed to be a lung. As you can see, it's not working very well. Again, because they're not athletes, they don't do anything, this can kind of creep up quite slowly on you. And actually, we've had it as cases of found dead that they've literally just breathing basically from their lungs and work. But the day before, in essence, looked relatively normal. I talked like rescue like interest and all this stuff, so that's why. But so basically, any organ system that there's a disease in can then be a risk of developing hyperlipemia. So 72% of donkeys that were suffering from hyperlipemia had concurrent disease. So that's a bit of a take-home message. We're not just talking about the condition, we need to know what's underlying it as well. Age certainly played a big part, so older donkeys were more likely to suffer from hyperlipemia, which again isn't surprising going on what we said, if they've got any sort of underlying disease problems going on, then that is likely to increase their risk of becoming hyperlipemic. Certainly, as we mentioned, we said anything that puts an animal into negative energy balance is likely to be a risk. So if an animal is inappetent, then already that should be an alarm valve, which is why we're really we hammer home the message that if your donkey goes off its food, then be concerned about the potential risk and get the animal checked out. Ideally, to find out either whether there's something else causing it, but even if there's not, just to check what the triglyceride levels are so that we're not starting to worry about this animal tipping into a negative energy balance and potentially running the risk of developing hyperlipemia. Weight loss, again, we did find that if an animal lost more than 10% of its body weight in the previous month, and again, that was a high risk for developing hyperlipemia. So this goes back to this, keeping an eye on. Whoa! Back, is that still working? Yeah. Don't scratch your leg, obviously, is what the moral of that story is. So, yeah, weight loss. But there's two sorts of weight loss you can get. The obvious one is that kind of rapid one. And certainly, if you get a rapid weight loss, then definitely get the animal checked out and get a blood sample taken. The weight loss can be sort of chronically progressive over time, and that's another one that you want to get checked out. Unless, obviously, if you're expecting it with a dieting animal, fair enough, but again, just be careful about how much you're dropping month on month. Again, another reason for not feeding anything with starches and cereals in it, we found that concentrate feeding was a high risk for hyperlipemia. And that probably links us back to the fact that there was also a high risk of gastric ulceration. Gastric ulceration is a painful condition that's likely to affect appetite and therefore could predispose to hyperlipemia. So again, not feeding cereal-based concentrates is really important. And I think this highlights the concept of how sensitive these animals can be movement and management change. So obviously one of our main movements is the sanctuary. That's obviously a massive movement change for an animal. Particularly if it's an older animal, it's been sort of one environment all its life, and then it comes to a completely different environment. But even moving between groups, having a new animal coming into the group, or just a management change as well, whether it's dietary change or anything. So dietary changes should be made very, very gradually, ideally over sort of a 6-week period, to try and limit the risk of anything exacerbating a stress within that animal. So some of those sort of risk factors, a few more coming up as well, but you can see why some of the things we've been doing, like appropriate feeding, assessing the type of animal you're bringing in, monitoring weight, assessing quality of life, routine health care with the dentistry. You can see, I can sort of maybe get a bit of a picture as to why doing these sorts of things are reducing our incidence of this condition. This was an interesting one. What we found was that bedding donkeys on paper or cardboard increased the risk of developing hyperlipemia. We also found it in another study we did looking at patch and pollets. And when you think about it, you know what I was just saying about their browsers? They love eating a load of fibre. You put something that's quite fibrous in front of them, like some paper or cardboard, they're like, whoa, okay, we'll have a go at that. And in certain parts of the world, they feed paper, cardboard with honey on it and things. So they will chew this, and if they're doing that, they're wasting all that time chewing something that's got no energy value in it, rather than eating what they should be, and they're filling themselves up on it. So you can kind of see why that might be a risk. So we've actually stopped using paper and cardboard bedding because of that. Now, in our particular study, we actually didn't find that being overweight was a risk factor, but there are a number of other studies that have, and I think it is a really important one to still consider. Saying what we're saying is happening, the more fat you've got there available, if you are going to go for negative energy balance, you can imagine the more likelihood of being able to develop this condition in the first place. And again, as we said, if you're going to diet this animal, it needs to be gradual. Any things you change must be changed slowly so that you don't predispose to a stressful condition that then encourages this animal to go off its food and then potentially go hyperlipemic. And you can see the fat there, yeah? That's a no-brainer, you know that donkey's fat. What we also know is that donkeys lay down fat in their abdomen. Okay, they lay it down around organs and they lay it down in the ventral abdomen. So that's basically, more practically again. That's basically ventral abdominal fat, and that marks up to 7 or 8 centimetres, and that within a fairly standard condition called free donkey. Okay, so they will lay down fat internally as well. You're not going to see that, but that's still fat that can then be broken down during the process of lipolysis during a stressful period. So there's not much you can do about that. It's just to bear in mind that they do lay down fat slightly differently to horses. Basically anything that stresses them out, because you don't know what it might be sometimes either. It could be inclement weather. We've had some after thunderstorms starting to go hyperlipemic on us, but you don't know what's stressing your donkey out, but just bear in mind that anything that's different could be stressing your donkey out. Being pregnant isn't great either, so being pregnant and lactating are both risks. I don't know about that. Being pregnant is lovely, but if donkey, one thing it does increase the risk of, remember we saw the massively pregnant donkey. There's a lot of stuff going on in there. We've got a lot of more energy requirements. We've got a bit of pressure on the stomach probably as well. So pregnancy and lactation do increase your risks of hyperlipemia as well. So those are the classic risks that you might be considering. We then got to think about if we're concerned we've got a donkey with hyperlipemia, how are we going to try and diagnose this? The important things are working out, has this donkey been stressed? And the important thing is to bear in mind, this doesn't have to be a stress 24 hours ago. Our standard one is we'll have an animal come into us, it'll be with us for maybe 2 weeks, or an animal loses a companion, and about 2 to 3 weeks later, they'll go hyperlipemic. So it's not necessarily an immediate response either. Okay? So that's something else to just bear in mind. You'll think back in the previous history, what might have happened that might have just predisposed an animal to some sort of stressful event. And say that stress could be travel. A lot of wild donkeys aren't necessarily that acclimatised to travel as opposed to certain horses that are maybe a bit more used to it. Travelling them can stress them out. And say, if they're very closely bonded, and sometimes you don't know how closely bonded they are. But if they lose a friend, then that can actually tip them over as well. So keeping up with it's always quite a good idea to keep a very close eye on what your donkey's feeding behaviour is like post losing a friend. So you're looking for your stressors, and then you're looking for the risk factors as well. So is this animal pregnant? Has this animal lost weight? Does this animal have some other disease process going on? So it could be just a simple thing like a management change. So from our point of view, when the weather becomes really rotten, which is currently about doing for us at the moment, then the management change does happen on the farms. They're not going to be going out to grass so much. They're probably going to be eating inside more, probably eating some more straw. So that's the sort of time when you just got to think, you need to make this management change. You need to try and do them as gradually as you can. Just monitor these animals during that time frame. And again, say you've got closely bonded animals. If you're going to do anything to one of them, make sure matey comes along. If it's going to the vet somewhere, make sure the mate comes along. If you're going to do some dentistry on one and it's got a friend, make sure the friend can stay with that animal. Yeah, so just trying to minimise anything that can stress the animals out. If they're bonded animals, then they do get stressed very, very quickly if they're not with their mate. And it just makes life easier as well. If you want to do something to one of these donkeys, it's going to stand a lot better for you if it's got its friend next door and it can see that friend and it can feel more in its more safe environment. So, what are clinical signs? I mean, that doesn't look like a very happy donkey. It's a fairly dull-looking donkey. Scrolling a bit, hold on 2 seconds. Right. So, we've got a lowered head carriage. There is a back, but also they're kind of fixed back. You can't see that from that photo, but then you get the impression they're not really going to be moving around. A normal, healthy donkey should be alert, the ears should be kind of going, that's what they're there for, they should be assessing their surroundings. So it doesn't really matter where the ears are, they can be fixed forward, fixed to the side, they can be at a jaunty angle, but if they're not kind of moving around, then that's not really normal, they should be kind of alert to their environment. And again, it's kind of like fixed gaze, it's sort of stood there. And possibly we have got a little bit of tension around the nostrils there as well, just to suggest that this animal is generally quite dull at best. The dullness is an important indicator in donkeys that something's wrong. It doesn't necessarily tell you what's wrong, and it certainly doesn't tell you it's definitely hyperlipemic. But if it's already dull, particularly if it's also off its food, you should be worried about hyperlipemia, at least as a secondary problem. The dullness can also quite often be related to pain in any case. Okay? They're more stoic, they don't tend to show the more obvious signs that horses might. The dullness with these other kind of behaviours as well, whether it's a reluctance to move, they're recumbent, we've already said that's not normal behaviour for a donkey, it's kind of lowered head carriage, the altered ear position and the fixed ear position. And one thing we found is that we talked about this closely bonded friends. What's quite interesting is that if one animal is quite sick, then often mating leaves it. And that's again maybe kind of a response to the normal behaviour in the wild, is if mate is going to get eaten by a lion, I don't really want to be stood next to him whilst that's happening. So, it's cruel to be kind possibly, but that was one thing we found, is that in normal donkeys that were stood together, if one got a bit sick, the other one would often leave it. But with all of this, and this is why I go back up to the first point I've got on that slide, is that a lot of this is the owner that's going to be telling you all this, because they're the people that are seeing this donkey, they know what its normal behaviour is like, they're going to be telling you that it's not behaving normally. And it's really important that we as vets listen to that, because I've been caught out before, you go on the farm and the donkey looks to all intents and purposes pretty normal. but I'm being told, no, it's not behaving quite right. You're like, Jesus, right, okay. And you do an exam and it's got something, got a passion column or something, you know. So minor changes in behaviour can mean major things happening inside this donkey. So we've got to be aware of that and listen to the people that are telling us about this to make sure we don't miss something that can be done correctly. Just put a moment there, you know, as animals do age, their behaviour is going to change a little bit. You know, they're not going to be the lively, useful animal that it was when a donkey was 4. So you've got to get a slight balance between geriatric behaviour versus dullness. But again, if an owner, certainly what we're saying is that just because they're older, they should still want to move around, albeit maybe a little bit slower. They still should have a good appetite, albeit it might be a bit slower. And they shouldn't be lying down for long periods of the day. So those sort of behaviours are indicative of something else going on, but the animal may want to slow down a bit and it's getting older as well, so it's going to get that balance right. And this is this classic, what we call helicopter ears flat out like this. That's a dull looking donkey, that's not a normal kind of ear posture for a donkey. I've just put in there just a kind of a little reminder as well, because obviously most of this kind of clinical science talking about from the point of view of concern with pain or possibly hyperlipaemia, obviously more linked, I guess, to non-working donkey. If we're looking at a working donkey, there may be other reasons why that donkey's looking dull. It could be dehydrated, it could be exhausted, or it could have some quite nasty conditions such as rabies and things like that. So yeah, we've got to bear in mind other things in the environment the animal's in when making major assumptions about what the dullness means. But it is an important indicator that something is wrong. And if the owner's telling you that there's something different about that donkey, then you should investigate why. Doesn't help us know why, and we've got to struggle to find out why, but at least we know that we need to look and find out what might be going on with this animal. So we'll do a thorough clinical exam, which obviously contains various things. Certainly know what that animal's condition score is, or say from our point of view, what the weights have been on that animal. Standard clinical exam, looking at temperature, pulse, respiration. Always check the digestive system. So we've talked about the fact we've asked about the appetite, what the gut sounds like. Certainly in an animal either with pain associated with a colic, but certainly also with hyperlipaemia, the gut shut down, they get gut stasis, so you get very quiet abdomen when you listen. The 4 places. And have we got any signs of abdominal pain? A lot of these donkeys are small enough that we can actually palpate the abdomen and determine whether or not we get any evidence of pain. We always do a rectal exam. We get called up quite a lot about the concept of rectal in donkeys. Obviously, very small donkeys, very young donkeys, it can be challenging, but for most standard-sized donkeys, and we're talking about things sort of up down to sort of below 100 kilos, you can rectal safely, and we'll just go through that in a moment. But just bearing in mind what I also said is that you've got a dull donkey here, but it could be any concurrent disease that's also causing this problem, that's the concern of hyperlipaemia. Don't forget the feet, because laminitis is a big risk in donkeys. So we'll always check things like digital pulses, food tests, things just to check the pain. The problem isn't in the feet, and then we need to deal with that as well as the concern of hyperlipaemia. Right, let's see if technology is going to work. One thing they're very clever at, because they don't really want to be showing you they're sick, is something called sham eating. Okay, and this is just an example of this. This donkey, it's possibly, I mean, his ears are still moving, so there's some kind of alertness there. Head's a bit low. He comes over, he's licking his lips. In he goes. Oh, okay. A little look, licks his lips again. Oh, I can have a bit of maybe have a bit of a chew. Absolutely nothing. He's not eating. Okay? He's pretending to eat. It's called sham eating. And it's quite a classic thing they'll do. It's a survival instinct again. But you've got to bear in mind that that isn't an animal that's eating. He's fooling you. And obviously, if you've been doing that for a few days, then there is clearly concern over the risk of the fact that this animal has been in a negative energy balance for a while. So sham eating, we always offer a bowl of food to see if they are eating, but you need to be very careful that they actually are picking that food up, chewing it and swallowing it. And as I said, we know that dental disease is a risk for developing hyperlipaemia. In another study we've done, we've looked at one particular problem, which is loss of teeth, and the prognosis for donkeys that lose their teeth. And we found that by the time they've lost about 5 teeth, then there is a high risk of developing things like polyps, natural polyps. When they get into the range of sort of 7 to 14 teeth being lost, their prognosis is pretty poor, for life expectancy more than about 6 months after that, which isn't really surprising. It also depends on where that tooth loss is. If you use a whole arcade, then that's a lot worse than sort of dotting around. But dental disease, it is a problem when we've got more elderly animals, and we need to make value judgments on whether we can actually do anything to improve the condition, or whether the animals, we're not going to be able to manage that animal from the point of view of the severity of the dental disease. And bearing in mind that that could be one of the reasons why we're hyperlipaemic donkeys. So say, a REX exam can be very useful. It can certainly tell you whether you've got any abdominal pain, whether we've got one of something like an impactional polyp that's the primary cause of our hyperlipaemia. Obviously, you need adequate restraint. You do have the options of things like sedation, and we've got buscopan, which how I've seen in it, which acts as a nice relaxant. So for smaller donkeys, or donkeys that are going to strain a lot, then using that before rectaling can be very helpful from the point of view of getting a better. You're clearly not going to be getting it very far, particularly if it's a smaller donkey, but we can get a good sort of survey of the caudal part of the abdomen. And more importantly, we can check what the feces is like, okay? And this probably is quite plasmonic, so quite specific to, or gives you a major kind of pointer that you've got a hyperlipaemic donkey. So if you threw that against the wall, it'll bounce back and hit your head. Yeah, don't try it, because it's not much fun, but it will do. And you can see it's all mucus covered, so that's been hanging around in that gastrointestinal system for a while. So it tells us we've got gut stasis, and so we'll be slightly concerned about why we've got that. Certainly hyperlipaemia would be one to be high on our list of concerns. But the one really important thing that we need to do, and you can do it donkey side in some cases if they're very bad, is take a blood sample and try and take it sort of early on in our examination, just to see what the serum looks like. And in essence, we said about the fact that it's basically fat in the blood, and the fat's in the liquid part of the blood, basically in the serum. So this is a sort of normal, fairly healthy-looking serum, and then we're going through kind of like shades of grey. So we're starting to get a bit murky in the middle there. You can fry an egg off that, couldn't you? So you can imagine that isn't going to be very great if that's what that animal's got circulating around its cardiovascular system at that moment in time. But be very careful, because that's fine, that tells you you've got a very sick animal, that tells you you might be concerned. This does not tell you you have a normal animal, okay? You will still need to get that tested for triglyceride levels, because we have, you will see in the kind of marginals that the animals could still be hyperlipaemic, even though the serum does look fairly clear. But certainly, obviously, if you're going up the scale there, that gives you a good kind of indication that things have gone a little bit wrong. And why is it a problem? Obviously, you see that that's clearly not great from the point of view of circulation. Well, the problems are that you get these secondary complications. So the primary problems, secondary complications, I'm not very good at it. The problems we tend to see are pancreatitis. We get, obviously, this really nasty, fatty, greasy-looking liver. You can imagine that's not going to be working very well. We get gastric ulcerations. We've got big holes in the stomach lining here. You can see here lots of little pinpoint holes all around the lining of the fungus there. And they go toxic. So they go into endotoxic shock. So you can see why it's quite serious. You've got to try and get in there quite quickly if you are going to try and treat. Because once you've got to these sort of stages, you're really up against it if you're getting a good outcome. So as I said, it can complicate any other process that's going on in that donkey. So we must always consider the nutritional status of that animal. So is it eating, and what is it eating? And is it sham eating? If it's doing that, it's clearly not getting any energy into it. Where there are any concerns about what condition's going on, whether it's a choke, a colic, the animal's off its food, get a blood sample and check the triglyceride levels. It's better to do that and know they're normal than not to do it and wait a little bit, because although I said that after a stress it can be a delayed response. Once the process has started, it's very rapid. So in 24 hours, this animal can be dead. Which is why the last point there is that if we've got any concerns, we'll treat before we get results if necessary, just to make sure that we haven't missed something that could then become catastrophic. And the mainstay of treatment really is, we said that we've got this negative energy balance. We obviously need to know, say, what else is going on, but we need to re-energise this animal with both fluids and some sort of energy source. If the animal's not, you need to probably know what the triglyceride levels are if you're going to just rely on glucose drenches. So the example we've got here, whereby we can probably put about 100 grams of glucose into a 50 ml syringe and drench that into that donkey. That might be a donkey that's on the road to recovery, or it's a donkey whereby its triglyceride levels probably aren't that high. You can't get much energy in this way. It's quite a very inefficient way of doing that. Our mainstay would be using a nasogastric tube and getting some sort of energy-rich source into this donkey. They tend to have quite narrow nasal passages and they bleed quite nicely through us, so we're always trying to use quite a small nasogastric tube. And because the gut integrity has probably been compromised, we've often put in some sort of pre or probiotic to whatever we're providing them with. And as I mentioned earlier, gastric ulceration is one of the sequels to hyperlipaemia, so and if they're already anorexic or inappetent, got this acid secretion still going on, so we'll always use a gastric protection as well. And just the other thing we've got to bear in mind is that particularly if we've got hyperlipaemic donkeys, you've seen what it can do to the liver. A lot of the drugs we might want to use are non-steroidal anti-inflammatories, get metabolized in the liver, so we've got to be a little bit careful about dosing with these drugs during this time period, so we don't get toxic side effects from the treatment we're trying to provide as well. But again, the owners can do so much here as well, so trying to just stimulate this donkey. We can't keep providing it with enteral or the other way we showed them IV fluids, so we need to try and stimulate this donkey's appetite as well, so we've just got to be very things again that we can provide. And with the nursing care, again, so it's quite an intensive process for an owner to have to cope with as well. So that just gives an indication of what we're trying to get in. We tend to use a cereal, a fibre-based cereal, which is ready bread, and just again go back to that slide where we have nutritional requirements, just to get that amount of energy into a donkey in a day. We're talking about quite a large amount of enteral feeding that we need to do. But you can turn them around quite quickly if you do restore that energy balance. And then the key is you just want to get them to start wanting to eat for themselves, and you want to do that as quickly as you can. If they're very, very sick, they're toxic, or we know they've got very high triglyceride levels, then we probably get the donkey in the room. We probably go with IV fluids as well, probably on top of our enteral fluids. Obviously, if it's in a hospital-based situation, you can calculate your deficits and you can get a bolus in straight away and then get them onto maintenance. But you can do this in the field as well. It's obviously not quite as ideal, but you can give, say for example, we'll give it sort of twice a day boluses of 3 to 6 litres, which we will add an energy source to. So at this stage, we're not worried about our sugars, etc. At that stage, we need to get an energy source to this animal. So we'll use dextrose, a solution of dextrose, and also get some amino acids and vitamins into this donkey as well to try and support it.
Final question. Is Hartman's LRS?
That takes a minute, yeah, correct. Yeah, that's yeah, it is. So you say here we've got some sort of appetite stimuli here. We're trying to kind of encourage this donkey to eat as well as whatever else. And anybody wants to spot the mistake here, this clearly was an old picture because this donkey's still paper bedding. So we wouldn't have it on paper or cardboard bedding now.
Dufilite?
Dufilite, that's an amino acid and vitamin mix.
Why can't you, for a stimulant, give them like sativa, like we do cancer patients and older people that can't eat?
Yeah, you can do that as well. So you give, so we use the ready breakfast because we've got on pretty well with it, and we in our case using this but you can use any sort of nutritional supplement that would be used in. The only thing you've got to make sure is that it doesn't have any fat in it. Okay, and that's because the other option we've got here, we talked here about using sort of standard fluid therapy. You can go to total parenteral nutrition, but you've got to be very careful that you modify it. Because most of the total parenteral nutrition available for certainly for humans would have a lipid content in it as well. And clearly what we're saying is we've got a problem with fat here, so we want to take the lipid content out. So we tend to make up our own, whereby we put it again with a glucose source in and an amino acid source in, with various vitamins and minerals, and make sure the lipids are kept out. Okay. And if you're going with total parenteral nutrition, so that basically means you're giving a standard, a continuous food source to this animal intravenously. You do need to keep an eye on the glucose level and measure your triglycerides every 8 hours just to monitor closely what's going on, and have insulin available, because if you get glucose spikes on this, you do need to try and get that back down with some insulin. So we're trying to address the energy balance, but if we know that 72% of our donkeys with hyperlipaemia have concurrent medical conditions, we need to make sure we're treating those as well. Particularly if those conditions are painful, we do need to provide analgesia. We will always provide a gastroprotectant, so we use omeprazole. And again, when you think about this equally, we've got potentially a toxemia, an endotoxemia, and obviously a massive inflammatory response, so you need to be managing those types of treatment as well. But then factoring in as well that you might have a liver that's not working very well either. So you might need to modify the therapy accordingly. So that's hyperlipemia. Just at the end, before I finally finish, I just wanted to go through the last kind of donkey, not donkey specific, but again, a donkey predisposed type condition, and that's looking at laminitis and the risk factors associated with it. And rather sadly, as you can see what I put at the top, being a donkey, unfortunately, is a risk factor for laminitis in the way we manage them. I should probably qualify that. If you're a donkey and you're in Africa, then the risk factors there clearly for laminitis are a lot lower. But bear in mind all the things we've said this morning already, you can probably see why in our kind of conditions that being a donkey in itself can be a risk factor. We can't change that. There are certain things down here we can't change. But obesity is a massive risk factor, and we can clearly try and do something to change that. Little exercise and dietary excess are two other things that we can actually do something about. Okay? So,
What do you mean by gender?
oh, sorry, females do apparently seem to have slightly increased risk of laminitis. Nearly there. I'm nearly there. I thought you were speaking of me. Okay. So this is the reason why we're concerned about, well, one being a donkey, but also these other issues like the obesity, the lack of exercise, and part of, so PPID or Cushing's is a condition which I'm sure you're aware of, but again is a risk factor for laminitis for all the same reasons, which is what happens is we get a high level of insulin in the blood, and possibly on top of that an insulin resistance. We also get this kind of abnormal kind of fat profile, and this fat secretes some abnormal cytokines, so sort of inflammatory mediators that come out of this fat. And that's what's the risk. So it's not the sugar itself, okay, it's what the sugar then does inside an animal that has all these other factors that increase the risk of developing this high level of insulin. And they've done some fairly unpleasant studies where they've actually just injected insulin into normal horses, not donkeys, and you can produce laminitis in normal horses just by excessively providing them with insulin. So that's what we need to try and avoid happening. Okay, so if you hold that fact in your head, it's the insulin that's the main problem. We can end up potentially with this vicious circle though, okay? So we already know that being fat and being a donkey means they're likely to be quite insulin resistant. And what that means is that whatever glucose comes into their system is not going to get taken up, okay? Which therefore means that they're more likely to have high levels of glucose Now, if we come in here from the side and we give them something that's massively sugary, it doesn't have to be that massively either, bearing in mind they're already potentially predisposed to having high levels of glucose. So if we give them a bit too much grass, or we feed them with something that's got a high level of starch or sugar in it, we increase the levels of glucose, and that then stimulates our pancreas to produce more insulin, so we automatically increase this level of insulin. And what that does is it has this two-way effect. What the high levels of insulin does means it reduces the receptors, the insulin receptors, which then means that we're more likely to be insulin resistant because you haven't got the receptors for the insulin to bind to and have an effect. It also has anabolic effects, which basically means in a donkey state, it's actually going to mean that we have more fat build up rather than more muscle build up, more likely, particularly if we're not exercising this animal. We know that with more fat build up, we increase our amounts of insulin resistance. And also going the other way, being insulin resistant actually means that we don't clear our insulin so well, and we actually stimulate more production. So we've got this kind of vicious circle going on, which all leads to this high level of insulin, and it's that which then predisposes the donkey to hyperlipaemia. There we go. I'm losing the plot now. So laminitis. Okay. I need an energy source. We've been through this already, but in essence, what I'm just trying to reiterate is this fact that you've got to be careful about how much sugar you provide. Be careful about the amount of fructose, because that's a grass sugar. And if we've got these animals that are overweight and they're donkeys and they're not doing much exercise, we've got that vicious circle already going on. Put a little bit more sugar into that, and we can just tip them over the edge to that massive peak in insulin and potentially a bout of laminitis. So again, be careful with the hay. If we analyse it, we just check how much sugar's in there, so that we know we're not potentially being a ticking time bomb for laminitis out hay, and that straw is probably the mainstay, so be careful about the amount of grain in it. I have finished now.
First of all, I have some bad news for Karen. That was so good that she's not finished. As an internal medicine specialist myself, the topic that she's talking about here is a subject of huge research. I mean, there are dozens of papers that come out every month on this whole issue. It is extremely complex, and I think that's one of the best descriptions I've ever seen of the whole pathophysiology. And we will get to the questions, but on Sunday afternoon, Dr. Nora Matthews and I were going to do a anesthesia surgery kind of workshop, basically discussion of issues that are specific to donkeys. If you wouldn't mind participating in that.
What plane?
When do you leave?
I think my plane goes 8 o'clock.
Oh, well, you'll have plenty. We'll talk about it. But anyway, I would really like to make that part of that particular discussion, if at all possible, because there's so many questions. I have dozens myself, and so I'm going to shut up. Yeah, questions anyway.
Microphone.
Quick question on IV therapy. What about potassium? Do you add KCl or?
Yeah, I mean, if they were going on IV therapy for any length of time, then we would. If we're just doing a sort of bolus, and say what the beauty of it is that if you get under control whatever the underlying disease is, usually within a sort of 24 to 48 hour period, you can turn these animals around really quite quickly with the hydration and the energy. So we're not usually talking about patients that are then on long-term IV therapy, at least with a kind of a fluid type. If they're on long-term IV therapy, they're probably on the total parenteral nutrition. But yeah, certainly if we were sort of going on more than sort of 24 24 hours of IV fluid if you're worried about potassium and what that and potentially add that in. Where are we going to?
Webinar?
Do you have any experience with using the human oral hypoglycemia agents like metformin in donkeys?
Metformin, yes. So I didn't go into, I kind of rushed through that a little bit just because there wasn't really going to be time. We do use metformin. I think the way you use it is really important, and we've tried to sort of think about it from the point of view of what it's actually doing. So metformin is a human drug. What it's supposed to do is literally just stop glucose coming out the gut, basically. So it's a fairly basic drug from that point of view. So if you think about how you might want to use that, what it shouldn't be is in place of what you need to be doing, which is reducing weight, getting some exercise into this animal, because long term you really want the animal to improve and reduce its levels of fat. But if you know that there's a potential for that animal to be exposed to a sugar spike, now a classic one would be sort of if you're going to turn that animal out or something, and you know you're a bit concerned about the sugar levels that animal might then come into contact with when it starts to graze, then that's quite a good time for using metformin, because it will then hopefully bind that excess amount of glucose that that animal might be exposed to. So we would try to use it, target its use rather than rely on its use, should we say, from the point of view of what we're trying to achieve. But we do have some animals that are metformin long term. We do sometimes have problems with compliance. They don't seem to like taking it very much sometimes. But yeah, we have used it. I think we use up to 30 milligrams per kilo. There's not a huge amount of data out there, we're saying no data for donkeys, and it's quite varied what they say from a horse point of view. I think it ranges from sort of 15 to 30 now, and I think we would often use the 30 milligrams per kilo dose.
Karen, are you still using clenbuterol as an anabolic steroid for?
We're not actually. So I think although qualify this, because I think we're picking it up quite early, and we're getting in there quite early with our treatments. We often find that if you can reverse that negative energy balance as quickly as you can, that seems to be the most key factor, I think, to whatever. In the past, we've tried using things like heparin and insulin to try and improve that kind of pathway of the body's natural ways to try and normalise the system, and we didn't really get any better response. And I think, we know why now, we're already insulin resistant, throwing more insulin than this is going to work. The hormone, like protein lipase, is probably working at its maximum in any case, so trying to overly stimulate that. And in the past, we have used anabolic substances as well, but recently, literally, with the reversing the negative energy balance and getting whatever primary disease under control, seems to have worked pretty well for us. And we say we don't really need to go down the line of total parenteral nutrition. We tend to go with the sort of bolus feeds. But I think also we're probably, again, looking at the type of patient we're dealing with, and if we've got a patient whereby we know we can't really fix what else is going on with it, we're not going to spend a lot of time trying to get that animal through something when we know there's other issues going on that we can't do anything about. So we're probably assessing those animals better than we have done in the past, and making value judgments on their quality of life and euthanasia appropriate. Where do I go?
Just a quick question, what age do you consider standard donkey geriatric?
Yeah. Again, there's no cut off because every animal ages differently, but certainly from a lot of the stuff that we do from the point of view of decision making, in anything over 20, we probably consider geriatric.
Coming.
I'm pretty loud though. My question
mine is about black walnut trees. I've been told that black walnut causes laminitis, is it because it messes with the insulin?
That's a specific, I think that's a specific toxin. So it's probably working differently. I was talking, that the type of laminitis I'm talking about there is very much a metabolic induced laminitis. There are other ways you can get laminitis. So a toxic process, whether that's a mare that's got a toxic uterus, an endometritis, or whether you've ingested a toxin. Historically in the past, all the research into laminitis was done on models like the black walnut. And I think what they've realised is that's one sort of laminitis that doesn't actually give you a model for the kind of standard, kind of more, well, for want of a better description, type 2 diabetes type laminitis, which is the more common route to developing laminitis now, which is why they've looked at the models of insulin, which tend to mirror more accurately the main type you get. So you still get toxic types of laminitis.
I see. My other question is about the oat barley straw.
Yeah.
Now, most of us donkey people, well, most of the donkey people I talk to, feed grass hay only. And that we were under the influence that oat and barley was like too high in proteins, too high in carbs.
Yeah, I mean, you've got to make sure that, say, the grains are there. If you've just got the straw product, then it's a lot lower in energy. And say when we analyse the straw, it usually comes up at about 6.5 megajoules, whereas most hay come up about 7.5, 8, 9. As long as you don't have the grain in it, then the straw itself is the best product.
I was always under the influence that straw had no food value. That's not true.
Not from the point of view of a donkey. They can drag so much more energy out of that than a comparable horse. I mean, it stays, the gut transit time is longer, so things stay in the gut for longer, so they just have a longer time. Basically, well, I say that, but they certainly have a longer time and a more efficient system for drawing energy out of a product that would be considered potentially too fibrous. That said, small ponies that still are sort of native breeds, like the Shetland pony and things like that, they do a lot better on straw as well. Because again, they have that, they're just much more efficient digesters. So people have also always been concerned about the risks of impaction colic from feeding something like that as well. Now, if the animal's not used to eating it, then I would strongly say you have to change them over very, very gradually. So the mainstay of all our donkey feed is straw, which hay gets supplemented to, the proportion dependent on the time of year and the group. But you say straw is the mainstay.
We're going to just be able to take one more question. No pressure. Okay, that's fine.
Hi there. So the question is with baby mini donkeys, if they're not supposed to have grain, which people used to do, what would you suggest? How are they getting nutrients if they're just eating oat straw or grass hay?
Yeah. I mean, they will get nutrients, but if they're youngsters, then we will supplement them with a balancer. So that's how you will increase their vitamin and minerals, and it will have a protein content to it as well. From the energy point of view, usually when they're younger, we're probably more likely to be hay than straw at that stage, but giving them a fibrous annual grass. But that's plenty for them to provide them with the energy they need.
So you wouldn't give them anything else, just the oat and the grass?